Hi, my name is Marisha Brooks, and this is my MSW Capstone presentation. My field placement was Child Enrichment Incorporated, where I serve as a child therapist and a family advocate. History and importance of CSWE. The Council on Social Work Education, or CSWE, set the foundation for ethical, effective social work. These 9 competencies help us become confident, compassionate, and competent professionals. My experiences in both the classroom and my internship helped me grow in each of these areas. Competency 1, ethical and professional behavior. I've learned how to manage my values and bias and uphold the NASW Code of Ethics. At Child Enrichment, I maintain clear boundaries, use supervision to guide my decisions, and always prioritize client confidentiality. Competency 2, human rights and social justice. This competency reminds me to advocate for those unheard. I supported youth navigating trauma and ensured they felt seen, heard, and protected, especially those in different communities. Competency 3, ADEI in practice. I use self awareness and cultural humility when working with diverse families. I practice inclusive language, adapting activities to cultural needs, and acknowledge identity as part key of care. Competency 4, practice informed research. I earned my TFCBT certification during practicum and used evidence based strategies in sessions. I adapted coping tools like the calm bottle and used ACE scores to guide intervention planning. Competency 5, policy practice. I recognize how local and state policies impact a child's access to resources. I supported families during mandated reporting and explained the policy process to help reduce fear. Competency 6, engagement with clients and communities. Building rapport with children was key. I used play, therapy, art, and games to establish trust and reduce anxiety. Empathy and reflection were central to engagement. Competency 7, assessment, individuals and families. I learned to access both clinical tools and natural conversations. I focus on child strengths, identified trauma triggers, and set goals collaboratively with caregivers. Competency 8, intervene with client and communities. I implemented skills like active listening, guided journaling, and confidence building tools. Many of my clients learned common strategies, and families were connected to needed resources. Competency 9, evaluate practice. I use feedback from supervision and clients to reflect and improve my approach. I also track outcomes like emotional regulations and goal progress across sessions. Summary of education and internship. This MSW journey taught me how to blend theory with practice. I've grown in confidence, clarity, and compassion, especially working with youth who've experienced trauma. I'm walking away from this program ready to lead, advocate, and serve. And these are my resources. Thank you so much for watching my PowerPoint. I really enjoyed the program. Troy was excellent. My professor was excellent. And you have a great day. Be blessed.